Hello again, everybody, and I hope you all are doing well. Welcome back to video 5 of the series. In today's video, we're going to be answering the question, what complications can happen from diabetes? So we're going to sort of answer why you, as a person living with diabetes, should be concerned about making sure your blood levels are low and then making sure your diabetes is under control. All right, so there's several different problems that can occur in patients with a long history of uncontrolled diabetes. First thing I want to talk about is that you can lose your eyesight if you have a long history of having high sugar levels. We call this diabetic retinopathy. The next thing that can also happen is you can get kidney failure. Ultimately, people who have kidney failure would have to undergo dialysis or get a kidney transplant. Next thing that can occur is that you can get what we call peripheral neuropathy. Essentially, you lose feeling and sensation in both your hands and in your feet. What this can lead to is that since you don't have any feeling in your feet, you can get these foot ulcers, this infection in your foot that would normally cause people pain. But since these people don't have any feeling in their feet, they can't tell that there's something going on. So here's a picture that of a beginning infection. You can see in the middle there that there's a little wound. Again, you might not be able to feel this. So it's very important that if you've started to lose some feeling in your feet, that you check and make sure that there are no ulcers present. If you do happen to see an ulcer, you need to get it treated right away. Severe cases of ulcers can lead to loss of the feet and overall rotting away of the feet. I'm going to show a picture really quick, and then I'll get it out. So if you are squeamish, you can look away now. But here's what can happen in some severe cases of foot ulcers, and you can see it's just gross, and we end up having to cut the foot off in order to prevent the infection spreading to the rest of the body. You can now look back for those of you who looked away. Finally, I also want to say that people who have a long history of diabetes are also at increased risk for having heart attacks and other blood vessel problems. Here on the right is this little figure that I saw summarizing the different complications going on with your eyes, your kidneys and your feet, as well as the heart and blood vessels, all these that I just mentioned. So I briefly want to say that I'm not trying to say any of this to scare any of you or to think that you're going to start experiencing some of these symptoms just because you've been diagnosed with diabetes. These complications often occur after having high blood sugar levels for years. And so after this video, I hope that you are now more informed about the complications that can happen and that you're motivated to keep your blood sugars low and avoid these complications. So I also briefly want to mention another complication that can occur in people who are living with diabetes. Typically, we are worried about blood sugar levels being too high in a person living with diabetes. However, if you're taking medication to try to lower your blood sugar levels, such as insulin or another diabetes drug, occasionally a person can take too much of this medication and have their blood sugar levels dip way down and get too low. We call this a hypoglycemic attack. So if you're taking any medications for diabetes, you should be aware that this is something that can occur. And if it does occur, these are the symptoms that you are going to have. Primarily, you're going to feel dizzy and really weak. You might start sweating, you're going to be pretty hungry, and you're going to have slightly increased heart rate. And finally, in severe cases, only in very severe cases, you can ultimately lose consciousness or faint. If you have a blood sugar monitor at home with you, this might be a good time to also check and see what your blood sugar is. Even if you don't, though, and you're starting to experience some of these symptoms, and you think there could be a chance that you took too much medication, what you need to do is drink a sugary beverage. I know in the last video, I actually told you not to drink these beverages, but in this case, what these sugary drinks will do is it will raise your blood sugar up to the normal level very quickly. And so this will help sort of get you out of that low sugar range. So that wraps up this video. As always, feel free to call or email me if you have any questions. Also, if you do have any other questions about this video, this would be a great topic to discuss with your physician or dietitian or any other healthcare professional. Finally, again, thank you for watching the video. I hope you enjoyed it, and stick around for a next video coming up soon.